Hello my dear students, welcome to my channel Patel Science Academy. I welcome you in the lecture number 9 from the chapter Reproduction in Lower and Higher Animals. Dear students, this is your teacher Shahzad sir, and in this lecture I am going to teach you about the STD, that is sexually transmitted diseases. During the process of intercourse there are some diseases related to that process, and in this chapter I am going to teach you about that process. Dear students, regarding that there are some myths, and it includes the most people with an STD experience painful symptoms. Birth control pills prevents the spread of the STD, and dodging will cure an STD. Abstinence is the best way to prevent the STD, sexually transmitted disease, and if you get an STD once and are treated, you can't get it again. A person does not need to see a doctor if she or he notices scores on his or her genital ones, but then they go away. Condoms helps prevents the spread of the STD. So, dear students, STD, what is STD? STD are the diseases and infections which are capable of being spread from person to person through the different sources, and it includes the sexual intercourse. By the sexual intercourse, sexually transmitted diseases can be spread, and another sexual partner can be infected by the STD. There are different STD. I'll explain in this lecture one by one, but before that we'll see the next source. It is the oral genital contact during the intercourse or in the non-sexual way, and the use of the IV drug. All these things are responsible for the infection of this STD. Dear students, before we go in the depth of this topic, I would like to request you to subscribe my channel, to like my videos, to share all my videos with the needies, and comments for your queries. Dear students, now we'll see the symptoms, the general symptoms of the STD, and it includes the source either painful or painless. The second symptom includes the person with the STD has bleeding in the urine, and burning sensation when urination, and rashes during this disease can be observed, and itching at the gonads region or in the reproductive region, and the bumps and warts, and the unusual discharge. All these are the symptoms can be observed as a STD during the process, during the spread of that disease. So dear students, one by one I'll explain here the different diseases known as STD. STD, it includes the chlamydia, and chlamydia is the disease as a STD, and you can have the different features of this STD. 4 million cases occurs each year for the chlamydia. Symptoms, it includes the fever, weight loss for no reason, swollen glands, fatigue, diarrhea, white spots on the mouth. All these are the symptoms of chlamydia. There are female symptoms. The symptoms in the female body includes the vaginal discharge, white or gray color liquid, or burning with the urination. This is the symptoms of chlamydia. Lower abdominal pains and bleeding between the menstrual periods, and low grade fever, later symptoms. All these are includes as the symptoms in the female body. While dear students, the symptoms in the male body, it includes number one, the discharge from the penis, or the burning when urinating, burning and itching around the opening of the penis, and pains and swelling in the testicles, and low grade fever associated with the epididymitis, inflammation of the testicles. All these are the symptoms of the chlamydia. Now we'll see about the next disease, that is gonorrhea. Gonorrhea, each year approximately 650 peoples in the United States are infected with the gonorrhea. People get gonorrhea from close sexual contact, anal sex, oral sex, and the vaginal sex. Gonorrhea can also be spread from mother to child during the birth, and gonorrhea infection can spread to other unlikely parts of the body. These are the symptoms and pics can be observed with the gonorrhea disease. You can see here this spot, red color spots and on the skins is the symptoms of gonorrhea. This is about the gonorrhea, and now we'll see about the next part. Next part includes the symptoms of gonorrhea. Symptoms of gonorrhea, it appears 5 to 7 days or can take up to 30 days to appear if person is having this disease. Sore or red throat if you have gonorrhea in the throat from the oral sex. Then the rectal pain and blood and pus in the bowel movements if you have gonorrhea in the rectum from the anal sex. These are the different symptoms of gonorrhea. The symptoms in the female body, it may show up to 2 to 21 days after having sex. May notice a yellow or white discharge from the vagina, maybe a burning or pain when urinating, bleeding between the periods and the heavier and more painful periods, cramps or pains in the lower abdominal region, and sometimes with the nausea and fever. All these are the symptoms in the female body. What are the symptoms in the male body? It includes the male's symptoms: yellow or white drips or discharge from the penis, and burning or pain when urinating, frequent urinating, swollen testicles, and all these are the symptoms of the gonorrhea. Dear students, now we'll see one more disease as a STD, that is disease number 3, and it includes syphilis. Syphilis, the long range effects can be very serious, including the death. And in the United States, an estimated 70,000 new cases of the syphilis in adults are found, passed from person to person through direct contact with a syphilis source. Sores mainly occur on the external genitalia, vagina, anus or rectum, and sores can also occur on the lips and in the mouth. The transmission of the organisms occur during the vaginal or anal or oral sex. The symptoms of syphilis in the stage 1, it includes symptoms usually appears 10 to 9 days after the sexual contact. An infected person get a sore canker which may be painful at the point of the contact, like mouth, anus, rectum, throat or the sex organ. The canker is usually firm, round, small and painless, and it appears at the spot where the bacterium entered the body. The canker lasts for 1 to 5 weeks and heals on its own, and this will disappear on its own but may last for 4 to 6 weeks. In the female, the canker is often internal and cannot be seen. So you can see the first stage symptoms in the syphilis patient here. You can see here and in this structure too the symptoms of the syphilis. Now we'll go for the secondary stage of the syphilis. It lasts for 3 to 6 weeks. After the canker comes a copper colored skin rash which may appear on the palms of the hands and soles of the feet, or in a more severe cases covers the entire body. The rash may be accompanied by the fever, headaches, indigestion, loss of appetite, or the loss of hair in the spot where the scalp. So you can see the secondary stage syphilis patient here. The symptoms on the palm, on the lips, here on the hand skin, and here on the sole. You can see these are the secondary stage symptoms of the syphilis. Now we'll go for the symptoms for the third stage, that is the latent period, and all symptoms disappear so that the victim thinks he or she is cured. If not received treatment, the bacterium remains in the body and begins to damage the internal organ, including the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Fourth stage, it is tertiary stage, and the result of the internal damage from the third stage show up many years later, 10, 20, even 30 years after the initial infection. Sudden heart attack, failure of visions, loss of motor coordination, or the mental disturbances includes as a tertiary stage symptoms. Now we'll go for the next one, herpes. Herpes, its symptoms usually shows 2 to 20 days after contact. It may be extremely painful or very mild. Outbreaks of blisters and the ulcers. Once infected with the HSV, people remains infected for the life. Stress, breathing, coughing, or a woman's period may cause an onset of the disease. Female symptoms includes the blisters in or around the vagina, fever, and headache. And male symptoms includes the small sores or cluster of blisters on the penis. So you can see here the herpes, patient with the herpes. You can see these are the symptoms. Blisters can be observed here, and in this region you can observe the herpes on this penis likewise. So these are the symptoms you can see here and in this diagram too. So these are the symptoms diagrammatically. It includes the symptoms as a herpes. Then the genital warts or the venereal warts. It includes growth that appears on the vagina or the penis, near the anus, and sometimes in the throat. They are caused by the viruses and spread through the sexual contact. The viruses that causes the genital warts is spread by the vaginal or the anal intercourse and by the oral sex. Warts may appear within the several weeks after the sex with a person who has HPV, or they may take months or years to appear, or they may never appear. A person can be infected and pass on the virus without knowing it, and approximately 5.5 million new cases of the sexually transmitted HPV, one-third of all new STDs, occur in the US each year, with at least 20 million people currently infected, and the 3 out of 4 Americans between the ages of 15 to 49 have been infected with the genital HPV in their lifetimes. The symptoms of this disease includes usually the warts look like a tiny cauliflowers, but sometimes they are flat. The warts may cause itching, burning, and some pains, but often don't cause any pain at all. Warts may be inside the vagina or inside on the cervix or in the rectum or the throat, so you might not notice them. They might also be so small that you can't see them, and these are the symptoms. The pubic lice or the crabs. Now we'll see about it. Pubic lice are called the crabs because they look like a crabs. Crabs are frequently the color and the size of the small freckles, and these are very small lice. Crabs usually attack the sexual, that is the pubic areas of the body. Found under the arms, eyelashes, mustaches. Spread through the direct physical contact, close body contact with an infected person, and the symptoms are terrible, persisting itch, in the genital, rectal, sexual area. These are the symptoms of the grabs or the lice. So you can see here pubic lice, it look like this. You can see the symptoms of this disease. It appears like a crabs. In this diagram too, under microscopic observation, it look like this. So this is the disease crab. Now we'll see about the trichomoniasis. An estimated 5 million new cases each year in a woman and man occur in the vagina of the man, so may be sexually transmitted to men, usually infected the washcloths and the towels, and it is transmitted to the baby during the delivery, and it also can occur in the urethra, carries the urine to penis. In a man, doesn't have any symptoms. Usually symptoms includes appears within 5 to 28 days of the exposure. Women usually have a vaginal discharge. That female symptoms includes itching and burning at the outside of the opening of this vagina and the vulva, and painful and frequent urination. Heavy, unpleasant smelling greenish yellow discharge includes the symptoms of the female body. The male body symptoms includes usually nothing or discomfort in urethra. Inflamed head of the penis is considered as the symptoms of this male body. Now we'll go for the next one, candidiasis, the yeast fungus disease. Yeast fungus that may or may not be transmitted by the sexual intercourse, caused by the high doses of the antibiotics, and it is usually caused by the altering the pH of the vagina. And symptoms includes a thick cheesy vaginal discharge, severe itching. Now we'll go for the NGU, an inflammation or infection of the urethra, the tube that carries the urine from the bladder. It is passed from person to person during the intimate physical contact, and female symptoms includes pain, itching or burning around the vagina. Any discharge may be a sign of the NGU. And because the disease is internal, women sometimes do not show any obvious symptoms. The male symptoms includes discharge from the penis. This may be thin or watery, or thick or white, burning and itching around the opening of the penis, and sometimes the signs appears on the morning, then go away and come back. After 10% of the men show no symptoms. Now we'll go for the disease HIV, the killer disease. There are two main ways you get AIDS, that is vaginal, oral, anal, etc. sex. Sharing the drugs, needles and syringe is responsible for the AIDS spreading. Now prevention includes the abstinence process. I have explained about it in my previous lecture. No to your partner, be honest to your partner, limit your partners, there should be only one partner of your life. Visit your doctor for your queries, and always look after your body organs and keep clean. Remember dear students, people who engage in a premarital sex are nearly 50% more likely to divorce. 3 million teens contract an STD each year, sometimes have no cure, are leading to cause of the cervical cancer, or can even lead to infertility. This is about this lecture. Dear students, please subscribe my channel. This is your Shehzad sir, and I would like to announce here, I have crossed 1500 subscribers by your support, so it is boosting me, it is energizing me. So dear students, please keep subscribing, like my video, share with your friends and with all the needies. This is Shehzad sir saying you goodbye. Thank you very much.